Good afternoon, everyone. My name is Trina Shanks. I'm a professor and director of community engagement at the University of Michigan School of Social Work. I use the pronouns she, her, hers. Right now I'm wearing glasses and a caption that has like a colorful design and have curly hair. A note about accessibility, if you click on closed captioning at the bottom and show subtitle, you can actually see what everyone is saying in real time. And you can also put it to speaker view, so you can just see the PowerPoint slide and who's talking and don't necessarily see all the faces. We have a very special session today. We're exploring economic inequity in Detroit and leading toward a movement for greater equity. And so I'd like to start, next slide, please. I'd like to start by taking a moment to do kind of a brief land and labor acknowledgement. We know that this country was built on slave labor and land was taken but from Native peoples. And rather than reading this entire acknowledgement, I'm going to take a moment of silence for us to just read the statement and kind of focus on what's happened before. Thank you. We're committed to acknowledging past wrongs and doing everything we can to create a more inclusive tomorrow. Next slide, please. So I'd like to introduce you to the Engage team at the School of Social Work. Sonia Harb, Aisha Ghazi Edwin, Fatima Salman, and our two field interns, Blake Newman and Cleo. And so we're thankful for everyone who works with our team. And now actually I'm going to pass it on to Aisha and she's going to conduct the rest of the program. Aisha.
Hi everyone, welcome and thank you for joining us. I'm Aisha Ghazi Edwin and I use the pronouns she, her, and hers. I am a person with short black hair wearing a blue shirt and I will be facilitating this session. As a quick reminder, students of the Engage Community mini course, please stay on for a few minutes after the session ends. And to all participants, this is meant to be an interactive session. So if you have any questions, please feel free to type it in the chat and we will unmute you so that you can ask it directly. As Dr. Shanks just shared, this is a special session exploring economic equity and the movement for economic justice in Detroit. We have some amazing guests who are joining us today. So please join me in welcoming Ebony Taylor, who's the Michigan Executive Director of Mothering Justice, DeWayne Wells, Executive Director of the Economic Justice Alliance of Michigan, and Dr. Alicia Ferris, Chief Operations Officer of the Restaurant Opportunities Center. So I'd like to take a few minutes and allow each of our guests a chance to introduce themselves and the organization. Please, if you could state your preferred pronoun, as well as some identifiers, just to help make the session more accessible for everyone. And if you could answer the question, what does economic equity mean for your organization? I know that a few of you have put slides in the presentation of your organization, so I think you'll end up just answering this question by describing the work that you do. So Ebony, why don't we go ahead and start with you?
Absolutely. Thank you so much, Aisha. Again, my name is Ebony Taylor, and I am the Michigan Executive Director of Mothering Justice. And my pronouns are she, the she series, she, her, hers. And I am a Black woman with
Ebony, I think that you are muted.
I do not know how that happened, but okay. I don't know what you all heard, so I'll just start from the beginning. My name is Ebony Taylor, and I am the Michigan Executive Director, of Mothering Justice. My pronouns are she, her, hers, and I am a Black woman with short black locks and a light pink sweater. I am super happy to be here. I'm an alum twice over, if I can put it that way, of the University of Michigan. I did my undergrad there. I graduated in 2008, and I also did my master's in public policy at the Ford School and finished in 2013. So I'll just jump right in. Mothering Justice is a statewide organization, and we are headquartered in Detroit. It's an economic justice org that advocates for changes in public policies as it relates to our mama's agenda, which is essentially our policy agenda. Our advocacy also includes a leadership development arm where we equip BIPOC mamas with the tools they need to elevate their voices as experts who are on the front lines of policies impacts. Our Mama's Agenda is curated by conversations that our organizers have with mamas in the community. So for each of our Mama's Agenda issues, we have an organizer assigned to that issue, and they maintain, they keep that conversation in the forefront of their work. They keep that issue in the forefront of their work. And these issues these are the issues that continually rise to the top for us that we then include into our Mama's Agenda. So right now we are super laser focused on 4 issues: Black maternal health or justice. Sometimes we use them interchangeably, which is one of our newer additions to the Mama's Agenda, but it includes Black maternal mortality and maternal incarceration. The second one is our safety net pillar, which has historically looked like us working to safeguard programs like SNAP and Medicaid, including the fight against work requirements. We are beginning, though, to shift to other issues like housing and utilities, definitely wanting to uplift the water issue here in Michigan. Next is quality and affordable childcare in terms of access to it, which includes, but is not limited to, increased funding for Michigan's childcare subsidy program. And childcare is certainly a gateway, and it's one of our top issues because it's a gateway for many mothers to enter the workforce. But because it's so expensive, it forces many moms to stay at home. Lastly, we have paid family leave and earned paid sick time, which includes our fight to expand FMLA and to restore Michigan's earned paid sick leave law to its original intent. Our organizers, again, they're working on these issues and are crafting policy asks around them alongside our mamas and our legislative champions at the state and federal levels. I mentioned at the top of my comments that we also have a leadership development arm, and that includes 3 fellowship programs. We have Mamas University, which is online, where mamas who are interested in becoming more civically involved locally learn about how BIPOC women, or learn about BIPOC mama or woman-centered activism and movements have looked historically, so that they might lend, they might be a basis for how we move today. There's the Movement Fellowship, which is sort of like a 101 sort of fellowship program. We have sort of like policy 101, comms 101, organizing 101, et cetera. And finally, Accountability Academy, which is designed for white women who are interested in learning how to be true allies and to follow the leadership of BIPOC mamas and women. Last, but certainly not least, we have a voter engagement program called the Mamavis program. And this is one of our premier and probably most popular programs that includes training that culminates with participants reaching into their own networks and out to their own networks through a series of touches, like handwritten postcards, for instance, encouraging their networks or their people to vote. And I will go right into into what economic equity means to us, but in case there's more that you all would love to learn about Mothering Justice, I have included ways to contact us, ways to stay in communication with us, and to learn more about our issues. But at Mothering Justice, economic equity means that BIPOC mamas have the opportunity to not only participate in our economy, but they have the opportunity to thrive in it as well. And for us, it also means the dismantling of racist and misogynistic systems and narratives that help to maintain the status quo, and they stifle true economic equity. It's currently and has always been an uphill battle to be a mother in the workforce who is not in a superb financial position. And as I mentioned, we're an economic justice organization, so that's threaded throughout all of our Mama's Agenda issues, because they have impacts on mamas as current participants in the workforce and as potential future participants. And childcare, for instance, is one of the issues that really cuts deep along this line of economic impact. Many of us, I'm sure, have heard of the woman Shayna Bell, who's a single mother who recently left her kids in a motel room where they were living at the time so that she could go to work to provide for her family. And you know, there are a number of issues at play here, including the criminalization of poverty, but it's reduced ultimately to a decision that she was forced to make that no mother should have to make, which is to either provide for her family by going out and going to work and, you know, having income to pay for their motel stay, or to stay home and care for her children and take care of her children. So childcare in America is wholly underfunded, and in Michigan is absolutely and most certainly the case, except for the very recent release of the governor's budget that would allow for a tremendous boost to Michigan's childcare subsidy program should it pass. In general, the childcare system is based in racism and misogyny, where the majority of childcare workers are Black and POC women. This has historically, going back to slavery, been the work included in slave labor. And although numerous reports, especially as of late, you know, have noted the necessity of childcare to the resurgence of our workforce and economy, it is still largely regarded as women's work that is not prioritized or adequately resourced. This not only includes recipients of childcare, like I mentioned, the mamas who are in need of it, but it also includes provider pay and the informal childcare sector. I can go on and on and on, but I think I'll stop there. But that's economic equity for us, and these are just touching on the surface of the issues that we are, the depth of the issues that we cover. And so I thank you all again for having me here, and I suppose I'll pass it back to Aisha.
Thank you, Ebony. I mean, you guys do amazing work. Mothering Justice is such an amazing organization. We're going to dive deeper into some of the issues that you mentioned and some of the policy work that you guys are doing, and how has COVID-19 impacted and exacerbated some of the racial disparities we see in economic mobility and equity. So next, I'm going to pass it on to Dwayne Wells of Economic Justice Alliance Michigan.
Thank you, and good afternoon, everyone. Happy to be here. My name is Dwayne Wells. I use the pronouns he, him, his, and I currently serve as my identifiers. I'm an African-American male with glasses with a red sweater on, which is a little warm for my office, but we'll go forward. So I am Executive Director of the Economic Justice Alliance of Michigan, or EJAM for short. And EJAM is a coalition of grassroots social justice organizations that individually work on a range of issues ranging from LGBTQ rights to reproductive rights to economic, equitable economic and community development. But under the EJAM umbrella, they've come together to collectively work on leadership development programs and issue campaigns to build working class power. And we do that. And then if you'll flip to the next slide, just shows our 5 partners. So you'll note that 2 of our 5 coalition partners are on this panel. So happy to be here with Ebony from Mothering Justice and Dr. Farris from Restaurant Opportunity Center in Michigan. So the 5 organizations work statewide on a number of organizations, but work collectively in our work to sort of advance economic equity. Would be on the next slide. Our premier program would be our 9-month Michigan Economic Justice Fellowship, which is a comprehensive program, a paid stipended program that provides training on organizing and movement building, media relations, how to do a power analysis, and then deep dives on some of the social justice issues that face us as Michiganders over a 9-month period. And then those, the fellows get to utilize what they've learned and a 40-hour practicum that they do with one of our partner organizations. So we certainly think, one of the components of an equitable economy are engaged citizens who recognize their power and have knowledge of the legislative processes and political processes and financial processes and are allowed to and exercise that through input in various democratic processes that are going on, from voting to participating in what's going on with education to transit to whatever the issues are that are important to them in their communities. We also have worked on a number of policy and systems change initiatives that would promote employment and economic equity for Michiganders. So we, along with our partners here, Mothering Justice and ROC, have worked on the One Fair Wage and the Earned Pay Sick Time ballot initiatives back in 2018. We've worked in the space of community benefits, so ensuring that communities benefit from the development that's taking place in their community. A lot of that work has been done here in the Detroit area. We're particularly proud of in the last electoral cycle last year, we were able to contract and train and employ some of our graduate fellows to do canvas work or service poll workers. So they got to, again, utilize some of the training and experiences that they got from the fellowship and be paid for going out to do that canvas work and educating voters on the issues and on the importance of their vote and their participation in the process. And we really feel like, I guess that would be the second component of economic equity that we're fighting for. All of these sort of advances really help to promote an environment that provides equal access to quality jobs and all of the other sort of indicators of economic, wealth building opportunities. So that includes things like home ownership. For a lot of people, their homes is their major asset. And we know that there have been historic, barriers to housing and access to capital and mortgages for people, and also access to quality jobs. So an equitable environment would provide equal access to quality jobs. And by quality jobs, I mean jobs that have wages that are sufficient to cover basic living expenses and provide an opportunity for wealth building, working conditions that are safe and free from discrimination and harassment, and then a package of benefits, which would include things like paid leave, family vacation time, access to a 401k or some other retirement savings vehicle, disability and life insurance that would provide a level of coverage and protection. So we feel that economic justice and economic equity has to include those components of engaged, empowered citizens who are involved in providing input to the process, as well as equal access to the economic engines of the the nation and the state.
Thank you so much, Dwayne.
And I did
So-
add at the bottom, excuse me, the website, we have launched the application process for our 6th fellowship cohort, which will start in April. So if folks who are interested can click on our website, go to the fellowship tab, and receive more information about the fellowship program and the application process.
Great,
Thank you.
awesome. Thank you. And we will send out information after the session to all the
Great.
participants. So we'll make sure to include that link. Okay, Dr. Alicia Ferris, would you like to go ahead?
Yes. Okay, Alicia Renee Ferris, preferred pronouns are she, her, hers. Identifiers for today, unlike the first picture they put up of me, I am wearing glasses today, and also I have reddish brown hair. My organization is Restaurant Opportunities Centers United, but Rock, Michigan is what the work of Rock, Michigan is what I'm representing today. My current role at Rock is Chief Operations Officer. So I just recently, over the last several months, got a promotion, but I was the state director for Restaurant Opportunity Center of Michigan for several years. I'm very proud to be that. Talk about the work of Rock. We represent restaurant workers. That's what we do, particularly low-wage restaurant workers. We were founded after the 9/11 event that happened, and we have been, so we're celebrating 20 years. Of course, that was a tragedy, but out of that tragedy has birthed so much. Our mission, of course, is to improve wages, improve the lives of restaurant workers. I say that very succinctly as saying improving wages and working conditions. And the reason why the restaurant industry is our focus is, number one, we grew out of that. The organizers that put it together, they were restaurant workers. They were promised some employment after the tragedy, and dealing with that level of tragedy in terms of workers that were lost in that worked for Windows of the World. So those were some of the organizers that put together, they were the founders of the organization. And so our vision, of course, is a society that treats really everyone, but we say for our purposes, restaurant workers with dignity and respect, and that prioritizes racial and gender equity. And we have to say that because this industry, the second largest in the country, has been grappling with the issue of these race and gender problems for years. That is why, in fact, that there is a tipped worker kind of wage, a tier in terms of wages. And that is really the direct legacy of slavery, because at one point, people were, of course, slaves were free labor. And so when they were free, they had to find something to deal with them because they didn't think that they were equal anyway. And so they said to them that you will work for tips. In other words, you will not have any dignity. You will be reliant upon the generosity of the people that you serve. And so we are certainly, one of the critical fights that we have is eliminating that. And the crux of our work is about building power for restaurant workers, having their voices to be heard. We think that that's so critical. When you look at what we've noted and have not seen any recent data, but was tracking an Alice report that said in 2019 that 43% of Michiganders lived in poverty, not able to meet their basic household needs. So when you look at that, and when the restaurant workers that we've dealt with over the years, they certainly have fit the category of working poor. When you find that someone they're working 40 plus hours, often restaurant workers work 2 to 3 jobs before the pandemic to just try to make ends meet. To work a full-time job and still have to be homeless, sleeping on couches of relatives is just, abominable. And so as we look at it and the work that we have done at Rock, it continues to propel. Next slide, please.
Sorry, Alicia, for some
That's
reason.
okay. All right, I'll just continue to talk. when we look at that, we're looking at right now supporting the raise across the country. And Rock United has 10 chapters across the country. But Michigan and our other chapters have been dealing with, our focus has been on raising the Raise the Wage Act. We think that that's so important, but at the same time, I will say to you that economists say $15 is still not enough. When you look at the records, what it's indicating is that for a household of 4, you need to make at least 61,000, and those were numbers based on 2019. And so $15 an hour still will not get you to that. And certainly 2 years later and post-pandemic, but it's a start, which is what we thought about, the importance of it just be a starting point. That's far better than where we are in Michigan, where the wage continues to be around $10, a little less than $10. In terms of the pandemic response fund, we raised more than $1 million, and money is still coming in to really help workers across the country. And when we're saying help, maybe to be able to put food on, to buy some groceries for a couple weeks, those kind of endeavors, we were able to send them money. We then look at continuously partnering with Mother and Justice on paid leave for workers. Critical, because the people that serve you in restaurants, you would believe they do not have, most of them do not have paid sick leave. So if they come to work sick, then eventually they're passing it on to the consumer. Let me give you one such case, in that a mother, it reminded me actually when Ebony is talking, one of our restaurant workers, not in Michigan, but in another locale, died during the pandemic working with the coronavirus. She felt like she didn't have any other recourse because she had to feed 4 children. She died in the stall. She was a manager of a restaurant, couldn't get anybody else to come in, afraid to lose her job. She died in the stall of that fast food restaurant from the coronavirus. So can you imagine how many people were exposed because she didn't have sick time to take? Apparently the restaurant managers weren't taking advantage and informing people about all of the action, the government actions. She died. And you know, both she and her husband were in the industry, so they had to do what they had to do. Also, racial equity training for restaurant owners. We continue to push that because we did a study several years ago at Rock, where we actually went into restaurants as observers. And we recorded what we saw, and essentially we did not see any people of color in major management positions in those locales, nor did we see them at the top. You know, not only were they not managers, for the most part, they were hidden behind what we have a book called Behind the Kitchen Door. They were back there and relegated to, you know, being short cooks, sous chefs and so forth. That's where they were working. So when we look at that, we have to do that. That's also what the tipped wage brings about, the type of sexual harassment that takes place when you're supposed to, or asked by managers to wear a low, if you want to get better tips, cleavage, show your cleavage, show more of your legs, and that way you will advance your tips. So this is, certainly behavior that we cannot embrace. And eliminating the 2-tiered system of wages in Michigan was critical to us, so much so that, as Dwayne mentioned, we launched a 2018 ballot initiative that we met all the criteria along with Mothering and Justice for the paid sick leave. We did all of that, and then the legislators stole it when they were ordered to put it on the ballot. They passed it as is, as we had it, which would have been a win for the people of Michigan. As a matter of fact, 1.2 million people, households, would have been impacted positively about that. So at that time, about 25% of Michigan's population would have been positively impacted by raising the wage. However, in the lame duck session, they stole it away from us. They adopted it for the explicit purpose of being able to gut it, and gut it is what they did. So even now, we said then that at least we would get to $12 by 2022 had our legislation remained intact. But of course, that did not happen. And so we find ourselves in these critical spaces now, protecting and defending. We mentioned the other part of our work is raising the voices of restaurant workers. We began to come engaged in a relational voter process where we got out and educated people about the importance of their vote and the necessity for building power and protecting democracy. So as we were doing that work, DeWayne mentioned work that was done in the last election cycle as well as Ebony. I am so pleased to report that we touched 1.5 million people throughout the state of Michigan with our Rock My Vote campaign drive. Again, it was hands-on we couldn't do face-to-face. So texting, telephone calls, messaging, social media, messaging, all of those things to encourage people to get involved in that. Our post work is working with about 20 other organizations under the auspices of Detroit Democracy Action Working Network to protect democracy statewide, getting out there, continuing the work, using such a model as what was used by Stacey Abrams to really turn it up so that we can turn out the vote in mid-elections and so forth. If nothing else, we were clearly shown that democracy can be stolen away from you at any time. You can win fair and square, as we did pushing these ballot initiatives, but there can be a quest to take away all of that has been won. So we continue to do that. We participate in the Economic Justice Alliance of Michigan Fellowship. It is our way of partnering together to make sure that we're stronger and that all of our, along with our other partners, that our workers, restaurant workers are able to better understand how to raise their voices and how to get out and be actively engaged in their, in their work, in their communities, and as well. So that's what it is. When we look at economic equity, how would we define that? All of what Dwayne has said, all of what Ebony has recounted, by the time you get to the third person, it's hard to be unique. So we'll say ditto, ditto, plus the fact of dignity and respect for all. You should not go to work and not be able to meet your basic needs, to be able to purchase a home if you want to, a car, a decent transportation, to have, to be able to pay for quality childcare. You should be able to send your children to college if that's what you desire to do, and to have some meaningful input, to feel good when you look around to say, this is what I've accomplished by working every day. And so we say economic justice means that you don't have to be reliant on public assistance. You don't have to be subsidized because you're earning a living wage. You're earning at the capacity to be able to support your home. When everyone is able to do that, and we've torn down all the barriers that exist in terms of gender, race, etc., then we can achieve economic equity.
Thank you so much, Dr. Ferris. And you guys have all touched on such important issues. I want to talk a little bit about, this is to all of you, I want to talk a little bit about how COVID-19 has amplified these racial and economic inequities. I mean, we know that economic inequity in Detroit, lack of job access, is not a mistake. It was strategically created by historic racist policies that are ongoing. That led to white flight, that took away jobs, that kept people's home values down, redlined the entire city. And before COVID hit, there was a lot of reports out there saying that Detroit's on its way back up, that its job growth is really projected to be, exponential in the next 5 years. Actually, I do have some data on that. So it's tragic and it's horrifying in a 77% Black city that 81% of all COVID-19 deaths are Black individuals. Yeah. I think that shows, again, just the structural inequity. It's not that there isn't healthcare now. There wasn't healthcare before that was accessible. if you guys could talk a little bit just about how COVID-19 has impacted some of these economic inequities and issues that you've all talked about, from childcare, service workers, the labor force. What have you seen? How have you seen it impact the people? And also, what relief have you got and what relief is still needed?
I can step in for a second, just say that, you know, I listed our mama's agenda at the top of this conversation. And you heard Dr. Ferris just talk about our fights for paid sick days and leave, and also an increase in minimum wage. And had those things been implemented and they had not been stolen from us, there would have been, and we can't say that there would have been, you know, no one would be suffering right now. Everyone would still be working. Everyone would have money saved. We can't say that. But what we can say is that we would not be in such a dire situation as we are right now had the public policies that we've been recommending, that we've been fighting for, been implemented earlier, been implemented sooner, and honestly not hijacked from us during lame duck. And just to add just a few more numbers to what Dr. Ferris outlined, both of our campaigns separately got nearly 400,000 signatures from around the state to make it onto the ballot. Dr. Ferris mentioned that 1.4 million, correct me if I'm wrong, but 1.4 million folks have been impacted by the minimum wage not moving anywhere, not moving up or being watered down. And 1.7 million people, since our paid sick days bill was gutted, have been left out of being able to earn, not given, but earn paid sick days. I have paid sick days. I'm sure most of us on this call who are participants, we know what it is to be able to earn a certain amount of hours toward an inevitable, you know, it's inevitable and unfortunate, but we all are going to have a time when we need to take some time for ourselves or a family member or a child. And here we are in a pandemic where it's absolutely, it brought tears to my eyes hearing the story from Dr. Farris about the woman who passed at work. And those stories come all too frequently. And as Aisha, you've mentioned, they abound in the Black community. And so I have more, but I know I'm sharing this stage with my fellow partners, so I'll stop there. But I guess my whole point is just saying that a lot of what we've been talking about here, these conversations have not started in the midst of this pandemic. These are fights that have been going on before now, and had our policy makers and our leadership, had they been listening to us and following the data, following the research, we would not be in such dire straits as we are now.
Yep. Yep. And you know, there's been so much research done about how the Great Recession, right? Like the housing collapse, that Detroit was so vulnerable to economic collapse back in 2008 because of the history of redlining and discriminatory housing policies.
Yeah.
And just jobs being removed and removed. And now I feel like the same thing is happening again with COVID-19. You guys have been advocating for, you need to do more protections for workers. We need paid sick time. We need to raise the wage. It's not happening. And before COVID hit, unemployment was at 7.6% in Detroit. And then after COVID hit, it soared to 38.5%.
Go ahead, Dr. Ferris.
Okay, I say that rate is often wrong, because that rate only relates to people who were receiving, who were in terms of unemployment, were receiving unemployment or in the system It does not speak at all to the number of people where their unemployment benefits had exhausted and that they had been unemployed for several years because they couldn't find employment. They had, maybe prior criminal arrests, all of those kind of things. It does not speak to that. I do want to, in terms of your question about in terms of COVID and how it pointed out discretion. I was born and raised in Detroit and will die in Detroit. And that is that when we look at what's happening, I live in 4821. When they identified the 3 areas that have been hardest hit by COVID, I live in 48219. I work in 48221. I shop in 48235. And that those were the 3 hardest hit in the Detroit area. I live there. I've heard more people dying in my church when it reopens. I may never, that the loss will really show at that time, because if you're hearing 3 or 4 deaths of your, congregants every week, that when you get back and the buildings opens again, you're going to feel that loss even more in depth. So when we look at this and we look at that, they've known, even with the, give thanks to those who are really pushing to get the, coronavirus shots in Detroit, particular, because we have been hard hit. When you talk about workers, restaurant workers, I want to say again, the illustration that I gave you about the young lady that died, but the restaurant industry took a $500 billion hit. That's what is estimated. But here, more importantly, it was restaurant workers who have been displaced. The owners, restaurant owners, which, we're happy because they have to employ the people. They are getting some money. There is some stimulus money, so I have to acknowledge that, but not the amount of money that some of these restaurant owners will be able to write off in terms of losses and so forth. They will have that benefit. You can't do that when a restaurant worker is trying to figure out how I feed my family this week. How do I do this? And believe me, the unemployment system was overtaxed. I will say that it was really good that people want, the governor stepped up, wanted to get this money out, but the system was not ready for that level. And so many people have suffered while they've waited on the unemployment. And then I know Dwayne has another story that he will probably share with you, because they didn't even understand the burden of what happens when they receive that unemployment. I will say that even now, in terms of my advocacy for restaurant workers, to be called back to work or have to work doing that and categorized as essential workers, to have to work with that at that time and not be given protective gear is also horrible. To be in places where people have intentionally said, regardless, that I don't want to wear a mask, so I won't wear a mask in the kitchen. I won't do this. Those are what our workers have contacted us about, that they don't even have the protective gear. So just wanted to say that. And of course, the vast amount of those are people of color, Black and brown people, that are suffering at that level.
And can I just, go ahead, Dwayne.
That's okay. Go ahead.
No, I just wanted to say that, our communities, as Dr. Ferris just said something that reminded me of, just our spaces are not even primed to receive the help, right? We have so many deserts, so many types of deserts in our communities. I read a report not too long ago, very recently, about the pharmacy deserts, right? And the healthcare deserts. So when we talk about vaccinations, for folks who do not have transportation, which is another economic equity issue that I'm sure we might not have time to talk about today, but how are folks to get to these places to get a vaccine? And so when we talk about the impacts, we have been wholly we've been in positions prior to this pandemic to not receive food, childcare, again with healthcare and pharmacies. And so it is of no surprise to me that there that Black folks are lagging behind in receiving vaccines when we are the ones who need it the most. And so I'll stop there and pass the mic to Dwayne, but you know, just curious about how we might better the desert scenario that we are experiencing in the city.
Mhm.
Yeah, I'll just quickly add that I agree with all of the comments that have been made, but I think COVID has provided an opportunity because it has shone a light on so many disparities that exist in our society that contribute to, between the health disparities that Ebony spoke of, technology gaps, the digital divide and people being able to access to be able to work remotely from home or homeschool or educate their kids in a remote environment. I think there's been such a highlight on this that it provides an opportunity for us in our advocacy and our work to utilize that because they're very vivid and real examples of the barriers that people face in trying to provide for themselves and their families. I mean, I also think this, a year ago, few of us could define what we considered an essential worker. I think COVID helped provide an example and an illustration and lifted up the people who are really essential. And I think part of the reason why the death rates were perhaps higher is because we know that there's been data that's come out that said that people of color are overrepresented in those lower paying service sector, retail jobs, light manufacturing that have been, impacted by. So we've also used this opportunity then to refine, well, what do we need to do and what do we need to teach or how do we need to change our fellowship program? And we've sort of broadened our definition of economic justice to focus on things like personal financial literacy, because one of the what Dr. Farris was mentioning was I've had a number of people, I have an accounting background, and I've had a number of people that have called me and say, I didn't realize that the $600 extra I was getting a week, back last year was taxable income. And so now they're finding that they have significant tax liabilities. And so we really need to work to help raise that level of literacy so that people know that and they can plan and won't, hopefully not get in those types of situations. So, we're really using this as an opportunity to say, yeah, these are the disparities. There are barriers in transportation and housing and access to water and all of those things. And how can we engage people to really be a part of advocating for the changes that we wanna see in those areas?
Mm-hmm. Mm-hmm. And I think too, people need to realize that even though there was a lot of revitalization and development happening in Detroit, a lot of people were talking about how, and I would love for you guys to talk about this, stop building stadiums and skyscrapers and start connecting neighborhoods to this regional economy, to these economic opportunities. And the fact that there's so many jobs, actually, I have some data on that. There's so many jobs that are held by commuters that come into the city.
Absolutely.
And the jobs that are being created are not being given to the people that live in the city, predominantly the people of color who live in the city. Can you guys talk a little bit about just what was economic growth like in Detroit even before COVID hit? And was it fair? And what were some of the issues?
I can start out. No, I don't think it was particularly fair. One of the questions you would pose is, what is the state of economic? I mean, I think that there's been a legacy of segregationist practices around almost all of the areas that we've talked about that have, but certainly in the area of what I would call occupational segregation, where again, Black people, people of color are overrepresented in the lower paid jobs. And as you move up in almost any field, and I'm probably most familiar with the food sector, given, past roles that I've had, but I know when you get to the upper processing jobs, those are the percentage of people. But when you get to like restaurant workers and you know, front end processors are definitely overrepresented by people, and many of those positions are below a livable wage. So yeah, I do think that there's lots of work that is yet to be done to overcome some of that, but I think we're on the path to do so. And again, I think we have data that we have not had and personal experiences we've not had before that will help really add substance to those conversations.
I would say too, if I might add, you're absolutely right. We fight for community benefits agreements where dollars that when they come in for major development, we want to see development happen, but we want to see it happen with equity there, that the residents should be beneficiaries of that. When you talk about these tax incentive programs that will allow people to come in, get tax dollars, take our tax dollars, and then not even mind the fact when millions of dollars and only apply and saying that they're going to provide jobs to Detroiters, and when they don't, and the reports that they don't, the fines are not steep enough to discourage them. If they said that if you fall below this line, then what you're going to do is repay us all those tax money, then they would get serious about trying to identify and train people. But without that accountability, that strict level of accountability and enforcement, it's not going to happen. So and then the other part is the deteriorating community neighborhoods. We live in neighborhoods. We don't live in stadiums. So when you talk about the fact that there are so many vacant homes, and not only that, people being allowed to come in and buy them up, at little or no dollars, they're taking their loss for taxes or whatever, and then people are buying blocks. I've had over the last 2 months, people have been calling me realtors to ask if I'd like to sell my home. That gives you an indication that if somebody wants to buy your home, it's because they have plans for development, so that as people flee the urban areas and run to the suburbs, they have now come back and are coming back into Detroit proper. That was the plan for them to come back. And when they come back, that they could get these houses for a steal, because the houses that are on the market, we talked about these colleagues the other day, these are not affordable prices for people that are making, minimum wage. They can't afford $150,000 or $200,000 house. So who are you really setting up housing for and creating what you call affordable now? Who is it affordable? Who are you making these rates affordable for? So that's, those are some things that we really have to watch. We've got to safeguard what's happening in our neighborhoods, in our communities, versus what's happening and being done by corporate America.
Yeah. And then they're able to sit on those homes for however long, contributing to blight. And then the people who live in Detroit, who are taxpayers, end up paying for whatever blight remediation or cleanups that happen, while the folks who own the property, don't really have to deal with that. But one thing that I was going to bring up was the source of the revitalization dollars. I grew up on the east side of Detroit. My parents still live over there in the Chandler Park neighborhood. And I would say since like 2014 and 15, we've seen a lot of revitalization. The park, has gotten some cool additions, but the money has been all philanthropic and private sector funds. We've seen Chrysler Fiat, who they've recently extended one of their factories over there. We've seen the Kellogg Foundation come in to add to some of those additions in the park. And it's really honestly very disappointing that our own local governments and our state governments are just sort of relying on these philanthropic and private sector funds um, to be the main presence in the neighborhoods. It goes without saying that you step to midtown, downtown, apartments and things are market rate, and beautiful. It's something new being built every time you turn around. There are these tax abatements that Dr. Ferris spoke to, all these incentives. But then when you get to the neighborhoods and you get to the working folks who do, want to think about entrepreneurship in terms of being a landlord or creating a community garden, where are the incentives from the city? Where are the incentives from the state? And so these are legacy Detroiters, like my parents, who have been in their neighborhoods for years. My father was one of the first Black people when he purchased his home, the home I grew up in, at 21 years old. So these are the folks who our resources at all levels should be prioritized around, and they're just simply not.
Absolutely. So I want to give a chance for KJ to ask a question from the audience. KJ, I think I've unmuted you. You can go ahead.
Yeah. Hi, everyone. I've really appreciated everything I've heard so far. It's an issue pretty near and dear to my heart as a restaurant worker and as a citizen of Michigan. So my question was about this clarity regarding the vaccine timeline for restaurant workers. So like me and my coworkers frequently have these conversations where it's like, when are we going to get the vaccine? And we look at the guidance, and it's been really unclear as to where we fall in terms of being essential workers. We see like grocery store workers have a more clear timeline. I think they're getting it, I want to say, in April. But we don't know where we fit, even though people say we're essential and like we're not frontline workers, but people, relevant workers who should get the vaccine, but we don't know when we're going to get it. And it's kind of concerning because, especially if you work in a small restaurant like me, it's like we don't have social distancing measures. You can't, like, physically. And then, of course, I don't work in the kitchen, but for the people who work in the kitchen, I can imagine it's even worse because you're all way closer together. You have to have a mask on in like a really hot place for a long time. So there's just a lot of concerns unique to that. And it's really, my question is more about like, what sort of suggestions you have for maybe how we can make it more clear in terms of, or advocate for restaurant workers to get the vaccine sooner and be in a more safe working environment.
Interesting that you might, thank you for that question, and certainly something that we will take back locally. Yes, we have been pressing out in terms of a digital organizing campaign, but we need to hold our elected officials accountable for that. We need to be able, depending on the city and the county, to kind of put that on the radar. That this is important. If I'm to go to work, we need to know when this will happen. I think that, I don't know, again, what city or county, but I think the first start should be raising that with your elected officials and saying, we need this and we need it soon as essential workers, because you're right, they make it convenient in something. Of course, we know healthcare and they're on the front lines, but they also said very much that restaurant workers, they've said that, but they've not lived into that. So that's something that we will do. So thank you for that. I'm certainly going to take that back to our team to see if they can get some answers. And if we do, then we will certainly post it for, post that information on our website. I would say to Aisha, I will get that information to you today or so that it can be posted in terms of where we get that, and we'll post it on our website as well for Michigan.
Awesome. So we have two other questions from the audience. Ty, do you want to go ahead and ask yours?
Yeah, thank you, Aisha. My name is Ty Moreno. I am a 20-month student at the School of Social Work. I'm in Aisha's class. When we're talking about economic equity, I also was hearing a lot of us talk about literacy and like what the public doesn't know about why our clients need these services and why this is connected to systemic oppression. Because the reading that we had this week for class was about Detroiters taking to the streets in June and how economic inequality was coming to light. And with that, I couldn't help but think about the defund the police movement and the reallocation of funds, and how the public does not understand. They're not literate in the core components of defund the police movement. They think that, you know, the police department's budget has already been cut enough, and that the reason why there's so much crime is because of Black on Black violence. That is what the community believes. And so when we're talking about economic, because I was reading the comments, you know, after this Crane's Detroit article, you know, people get really wild on their beliefs. And you know, it just tells me what the community believes about the defund the police movement. And I'm also working with, like, in my internship to help the police departments of Livonia and Canton hire social workers full time. And so I've been to a couple of these community meetings where people, you know, council members are asking really, like, why do we need social workers, or why do we need to reallocate funds? And so I guess, like, what I'm asking is, how can the work that you all are doing with your clients and those in need also focus on taking funds from the police department and, you know, making that an important issue with, you know, economic equity?
This is Dwayne. I'll start with that. I mean, I think it's integrating it into our work, and that's a great example. As we were kicking off the fellowship last year, was right at the start of the George Floyd and all of the Black Lives Matter movement, and so that prompted a lot of discussions in our fellowship that weren't necessary. It wasn't in the curriculum that we were going to have sessions on police reform, and then as a result of those conversations, they decided that they wanted to do something to commemorate the 5th anniversary of Michael Brown's death and what happened in Ferguson. And so we built it into the curriculum. We broke out into subgroups, and one group looked at the Ferguson, Missouri Police Department, what they were spending their money on before, you know, 2015, and what they were spending it on now. Another group developed a social media campaign that could be put on Facebook just to educate. Another group looked at the city of Detroit's police department, what all of the components of that in the budget, and what were inputs for public comment, and making sure that those dates got out. So I think a key piece of it is that education and sort of raising the literacy on, you know, financial issues, on you know, civics, you know, which we don't get a lot of in at least the high school level anymore. So I think it's highlighting that education and then building it into the advocacy work that we do, whether it's our canvassing and our door-to-door work that we're doing, our leadership development programs that we put on, et cetera, and letting people know. And then once people know that they were sufficiently engaged that they wanted to learn more and do more about it, and a lot of those groups and a lot of that work that took place is still going on now. So that would be the answer that I would give to you, and thanks for the question.
Yeah, thanks for the question. At Mothering Justice, we don't, it is something that has certainly come up within our org. It is something that we want to find space for and be more open and upfront about, for sure. What I will say is that one organization that we work closely with, that I actually sit on the board of, it has it's called Girls Making Change. It's a program for high school BIPOC high schoolers, young women. And their last year, of course, we had to do a virtual fellowship, but their culminating project was about defunding the police. And what they did was they analyzed school policing and guards and, metal detectors. I almost couldn't think of the word, but they did an analysis of that and thought through how funds that are going towards these specific resources to police children, essentially, how they might have been better utilized within their school system, their school specifically, and some folks were outside of Detroit public schools as well. But I'm saying all that to say, I think that a lot of young folks are really activated around this issue. They're, seeing what's going on, and they're not turning a blind eye. And I think any work that we do has to be in partnership with youth-led organizations on the ground and grassroots and youth-led grassroots organizations, because again, Mothering Justice, we stand in support of the Girls Making Change program, and they chose that on their own to think through for themselves what defunding the police looks like, and to start in their own backyards, which is their schools. And so whatever we do, I think it needs to include our youth for sure.
That's great. Does Alicia or Dwayne, do you want to add to that?
Yes, I'll add to the point that, yes, I think it's important that we do that, the education around defunding. If I had been able to choose a word, I would have said redirecting funding, because I think that that's more appropriate. It does not induce fear, because people of color communities have long suffered from the fact of a lack of police response. So again, the thought is that if you take away money from them, then we certainly not, the money is going to affect us in our community. So I would have rather used a word like redirecting. But more importantly, I think that we all have to work toward decriminalization. This whole prison, from crib to prison kind of concept, that's what we need to move away. We also have to begin to promote restoration. So it is that we have, one of the things that we have been, ROC has been in the vanguard is of various programs like Restore Detroit, Restore Oakland, where we worked with people who were returning citizens, because the restaurant industry tends to be more friendly towards those people, because they're lower wages, right? So they would, largely look for people who were, if they weren't not violent crimes or something, or crime, such as they would probably look, in terms of robbery and those kind of things. We find the restaurant industry to be more friendly, but it's all about decriminalization. We have got to find, because we know that there's a tax on being Black, there's a tax on being poor, any person of color, it's a tax on people of color. So when you look at that, we've got to make some really look and educate people even about their being able to vote, even though that they, have been in prison. So it's a lot of work to be done, and we do consider those things in our work at ROC.
Thank you, Dr. Ferris. Dwayne, do you want to add to that?
No, I don't think I have much to add to what's been said.
And our Black, I was talking on mute, but in our Black maternal health pillar, I talked about how we added maternal incarceration. We just to the point of decriminalization, it is, I think, as we continue to learn more about, because our main thing is how our mamas and Black women, BIPOC women being treated behind bars when they're pregnant. And a lot of mamas end up behind bars for, essentially taking care of their families, and some just for state, what do you call them? Minimums. In the case where, I don't know if you all know about the story of Sawatu Salama Ra, environmental activist who had to give birth behind bars because she brandished her weapon, which was registered and unloaded, in defense of her family, and she didn't spend 2 years behind bars. But we added that piece to our pillar because we do recognize that there is that piece of growing populations, especially Black women we're one of the fastest growing populations. And so I think as we talk about defunding the police, that's what, we think about. What, what do we need to implement so that a woman who's pregnant does not have to give birth behind bars, does not have to be shackled at any point during her labor and delivery. And so how do we redirect those funds to, if a mother is experiencing addiction or otherwise, how do we focus on the real need instead of again the punishment or the criminalization? So it is something that we are I just wanted to double down on that point, but it is something that we are very interested in exploring.
Yeah, that's a great point. So I'm going to ask another question for a audience member who's had to leave, but is actually part of the class. There's a class that takes these sessions for credit. And she talked about during class, in a lot of social work classes, we talk about theoretically what reparations are for the Black community. And she had asked, I want to know, what does it look like for these organizations? Are they doing work around it? What would it mean for a city like Detroit? What does it mean for you personally? Anybody want to take that?
Yeah, who wants to take that first? That's a tough question for the end. I would start out by saying I think that there's a number of issues and considerations. That would have to be dealt with. My understanding, I think, is the Biden administration has supported the appointment of a group, a commission that would take a look at it and make some representation. But I think for me, if we could just address where we are, have some acknowledgement of what happened in the past and correct things going forward, I think that's probably the best start we can make towards reparations, is making sure that, again, kids have the same opportunities for educational attainment no matter what district that they're in, and people can get mortgages to buy houses or access to capital to support their entrepreneurial dreams. And if we can eliminate some of those barriers and be able to move forward towards economic equity, I think that would be a step towards repairing the past damages. And then I guess I would leave it to others more savvy to me to come up with whatever sort of calculation you would make for some sort of monetary credit. But I think just address and eliminate some of the barriers that exist would be a great start.
Yeah, I have to echo Dwayne's comments. Certainly just a real viable pathway towards wealth building. And that does come by way of entrepreneurship, land, home ownership. And as it stands, and not even considering the additional barriers that the pandemic has brought forth, but the number of Black entrepreneurs who are likely to receive a business loan. And then when you add in the pandemic, the number of Black businesses in Michigan who received the PPP, the numbers, and yes, folks were able to self-select, but the numbers that were received, there are very few Black businesses in both categories of $150,000 loans or more, or the ones in the other category of having received less than $150,000. Both numbers are pretty abysmal for the number of loans in total that were given out. So, and I'm sure Dr. Ferris could speak more to that, because a lot of restaurant owners experience that. I know myself, I've heard of a few Black-owned restaurants who are staples in their communities, who've been there for a while, or some that are new, that are doing really well, that were doing really well, just didn't see any of those dollars. So for sure, you know, it's just so many areas where the Black community are just completely just underserved, and just not considered, that I think it really will take a savvy and very thoughtful groups to think through what reparations would even look like at the city level, um, and um, and so on and so forth. So, I think it has to start somewhere. And a lot of people are, especially a lot of Black women, are creating new businesses right and left, and they're literally just having to rely on their full-time jobs or whatever jobs that they have to supplement and to feed their other interests or their entrepreneurial aspirations, because it's very difficult to get a business loan.
Well, I will say this, and this is old school. I don't think that there can ever be a figure put on the amount of suffering that people have endured. I don't think that we can pay people for the trauma of oppression. The fear of having to have the conversations, having raised two African-American sons, the conversations you have to have for them before they leave the house. Remember this, remember that. The repeat, there was at one point what Billie Holiday called strange fruit in terms of those lynchings from trees. Now there's been another way of lynching. So when we talk about reparations, I am just not at all sure that we will do, but as both my colleagues have said, if we eliminate the current barriers in that, but will there ever be a level playing field? I don't know, because I think, being a scholar in nonviolence, Kingian nonviolence, when I think about that, I think about the structural violence that exists and continues to exist in America, in the culture of that. So we would have a lot of work to do. I just don't know if any dollar figure could ever be put on that in terms of reparations that wouldn't insult me personally in terms of what I've seen. I mean, we would be talking about billions of reparations. And I just think that we break the bank. We wouldn't be able to ever repay people for the amount of suffering or to level. When you've been hundreds of years out front, how do you really level the playing field? So that's just old school talking with regards to when I hear reparations. It used to be 40 acres and a mule. No, it's a whole lot more in that. So that's my response, and I'm giving that as a personal response, not you said personal or organizational. So I'm giving that as my personal response to that. Never can repay me for the amount of days that I stayed up trying not to, wanting my sons to be active and out there and do things teenagers do, but being worried every moment of the way about what might happen while they're out there driving a decent car or something. So those are some of the horrors that we've dealt with, and the mistakes that have happened in communities, kids shot and all of those kinds of things. So those are the things that concern me in terms of conversations around reparations.
And super quickly, I'm also thinking about political power that has been, we've lost along the way. I'm taking it way back to Reconstruction and the terrorism that Black folks experienced, the terrorism that Black folks have experienced here in the city years back, and still to a degree just looks different now. And so at Mothering Justice, that's a huge part of why we say, why we lift up and we say we're a Black-led organization. We lift up BIPOC women and their voices, because there's been so much political power that has been lost, that has been diluted, that has been folks have been intimidated to raise their voices. And so when we talk about reparations, it's not just a dollar amount, it's not just monetary, it's also in ways that, again, with this group of savvy folks, it would have to be completely analyzed and defined in what ways we have lost out on being full and exercising our full citizenship and freedoms in this country, in this state, and in this city.
Thank you guys so much. And actually, you come to a good segue. One of the things that we really want to do, there's a lot of social workers on this call, and it's important for us to really have them think about calls to action. So if there's any initiatives or campaigns or things that you would like support with, please feel free to go ahead and mention it. And you can also send it to me and I will pass along the information to all the participants. I mean, that being said, what is one of the ways that we can help right now with some of the issues that all of your organizations are pushing?
Well, we've talked about one of ours, which is restoring the paid sick leave law back to its original intent. We are currently strategizing and have a plan of action for how we proceed to include those 1.7 million workers who have been left out because of the hijacking of the ballot initiative, excuse me. So we're actively working on that. There is some stuff coming out, maybe some sign-on letters and maybe, some calls to be made. So we would certainly love for folks to join in on that. Again, all of our issues, have policy asks. I'm thinking about childcare and how, we really want to uplift the informal sector. We call it at Mothering Justice, the other mother. So those are, your mom, your aunt, whomever else that you have to rely on when you do have to, if you are a waitress and you have to make it to work and you can't find childcare or you can't afford childcare, where do you send your child? And so, I shared our contact information. There are some things coming down the pike that we would love public support around. So there's one thing. And then also, even though the fellowship is full for this year, but our Accountability Academy that I talked about earlier, that's for white women to join, to learn how to stand in true allyship and follow the leadership of BIPOC women, BIPOC mamas. That is full for this year. And I think the wait list is one of our more popular ones. I think the wait list might be full for 2022 already, but certainly reach out to us we will do the best that we can to include all of those who are interested. But please just stay in touch with us. Aisha, you have, my information and feel free to share it.
Yep, and I will.
I would say that volunteerism is most critical, but even when you have, particularly for a skill, signing up to be interns or do fellowships with the organizations is critically important because you give them more hands-on abilities to be able to do it. As social workers, let me say, there's quite a bit of depression and frustration and so forth. You're needed like never needed before. I could see U of M, if you don't already have something, that setting up some kind of hotline where people can talk. When people have been have been required to shelter in for now a year, I'm hearing more calls in from our staff talking about their relatives and so forth that are battling with depression. they need someone to talk to. Not saying that you're licensed and able to move on it, but sometimes it's just having the ability to be able to talk through things, to be able to get encouragement from someone. And because you may be too embarrassed to let your family know that you're depressed, but it's been very few people that I've talked to that they don't say, whether staff or whatever, that someone in their family is battling depression. So I think that's key. And then with my partnership hat on, I would encourage the people to, if you want to support the EJAM fellowship, because it's our combined effort to develop leaders and to, to address critical issues, to receive some additional training and supports. But I think at U of M as a whole, just launching, that kind of thing, that people just allowing them the ability to talk to someone and to get that would be critically important. I don't know, of course, as a compliance officer for our organization, I'm not sure where that would take you or who you'd have to affiliate with, but that's a strong recommendation in terms of times like these. And it would be a benefit to, like, our restaurant workers would love to be able to direct them to some additional resources, because again, as we've said, they don't have benefit packages and that they can rely on. They need someone, in addition to the resources to deal with their basic need. There has been a stigma with regards to mental illness in people of color communities. So when you begin to talk about therapy or whatever, you're really trying to say, I'm crazy, instead of respecting, what therapy is really about. So we have to do something. That's another project. I'm a former professor at UD Mercy. I'm always thinking of projects. That's another project that may be, how do you start a campaign to let people know it's okay when the rich and affluent can say they've got 3 or 4 therapists and not be ashamed at all. They consider that bragging rights. Yet people who have struggled and live in a constant oppression don't feel comfortable telling, because they think that's another thing that you're going to hold against them. Those are just a couple of recommendations that I would offer.
This is Dwayne. Thanks for the plug of the fellowship. I was going to mention that, so I would certainly direct people to our website where they can learn a bit more about our work and the work of our 5 partner organizations. I know our partner Detroit People's Platform is doing a lot of work around community benefits and trying to do some scorecard or develop a screening tool and be involved in the city of Detroit municipal elections. So if that's of interest, and you can also access the fellowship materials and learn a bit more about the program on that. I think the other thing that I would make that you can get involved, I mean, if sort of working in a nonprofit environment, certainly organizations that provide service delivery as part of their programmatic offerings would be to be open to, that's a great way to combine your sort of academic pursuits and perhaps some of your other passions or interests. So the other thing would be, to definitely consider the nonprofit sector as you look for what your career pathway is, because many organizations, certainly those now that are providing direct services, I came out of the emergency food sector, so organizations, food pantries, food banks, et cetera, as well as, in the healthcare and other sectors that are providing needed services would benefit from the perspective of someone that comes from that social work perspective and can help in their program design and delivery. So that's a broader way to be involved, but I think a way that not a lot of people think about it, and there definitely is a need.
Thank you all so much. And I think that, bringing up mental health, especially as social workers, what does it mean to be equitable in the delivery of mental health care is very important. So thank you. So you all have been amazing. I want to thank you so much. Unless any of you have closing remarks, I'm going to hand it over to Dr. Shanks to close out the session. Thank you all for being with us.
Thank you.
Thank you.
So thank you so much, Ebony, Dr. Alicia Renee Ferris, and Dwayne. We appreciate so much you taking time to be with us today. You gave so much information and knowledge. It'll take a while for us to kind of digest it and hopefully be able to find ways to put it into practice. I'd like to talk about our next session, which is going to be on March 25th. Housing doesn't pause, housing insecurity during a pandemic. So both on our webpage and on this link, you can RSVP for that session. You can also look at our past and upcoming sessions. I think someone's going to put a link in the chat. And of course, all the students who are part of the Engage Community Mini Course can stay after for a session debrief. But otherwise, thanks again to our guests. Thanks to all of the people who participated. And we'll give you all the links and things in a follow-up email. And just please keep your eye open for our next sessions coming up. Have a great day, everybody.
Thanks, everyone.